Hi everyone, your team Emergency Medicine aims Rishikesh, and we are here to talk about key concepts of basic life support and ACLS. So let me introduce with my team. I am Dr. Nidhi Kele, Head of Department of Emergency Medicine at AIMS Rishikesh. She is Dr. Archana. Meet Dr. Takshak, Dr. Jewel, and Dr. Mukund.
BLS is a critical medical module that equips individuals with the skills to provide immediate care in emergency situations. Today, we will cover the fundamental principles and techniques of BLS. The key components of BLS are recognition of emergency, CPR, that is cardiopulmonary resuscitation, AED, automated external defibrillator, and relief of choking. Let's talk about the basic algorithm of healthcare providers of BLS. The first and foremost step of basic life support is verifying scene safety. Next, we have to check for responsiveness by tapping on the shoulders. Then shout for nearby help. Remember, once you're shouting for nearby help, you have to actually look into the eyes of the other individual and or call the individual's name and specifically ask for emergency medicine, emergency equipment devices such as AED and airway devices, specific preferably for age. Maybe you're asking for adults and pediatric age group. You have to activate the emergency response as soon as possible. This can be done using a mobile phone also. The other individual has to get an AED and other emergency equipment. You have to send immediately, ask for call for help. Next step is look for whether the breathing is present and checking pulse. Now remember, the check of pulse has to be done within 10 seconds. Here we will get three scenarios. One, both the breathing and the pulse will be present. Once the breathing and pulse are present, in that case, we just have to monitor the patient. If pulse is present and breathing is absent, then we have to provide rescue breath to the individual. In adults, the rescue breath is provided 1 breath every 6 seconds or 10 breaths is provided in a minute. Again, I repeat, 1 breath in 6 seconds or 10 breaths in a minute is provided. Now, in another situation, which is actually the most critical situation where both the breathing and pulse will be absent, we have to initiate CPR. The CPR has to be given in a ratio of 30:2 compressions. And as soon as AED arrives, we have to attach the AED, switch on the AED, attach the AED and give shock if the rhythm is shockable. Now, the important aspects of high quality CPR are your compression ventilation ratio should be 30:2. Number 2, one has to push hard and fast, that is at the rate of 100 to 120 beats per minute. Push at least 5 centimeters in depth for adults or at least 1/3 of the depth of chest. Allow complete chest recoil. Minimize interruptions in compression to less than 10 seconds. Avoid excessive ventilation. So let's get started with the adult BLS CPR.
BLS is the foundation of emergency medical care. It can mean the difference between life and death in situations such as cardiac arrest, choking, drowning, or severe trauma. Early intervention significantly improves the chances of survival and reduces the risk for long-term complications. Now we'll demonstrate a BLS scenario. A 40-year-old man collapsed in the middle of the street while going to the market. He is being attended by a bystander. The first step is to verify scene safety. As the person has collapsed in the middle of the road, we need to bring the patient to a safe area before proceeding for any further assessment. Now, second step is to check for responsiveness, which is being done by tapping on the shoulders 3 times and shouting, "Baba, aap theek hain? Baba, aap theek hain? Baba, aap theek hain?" Since the person is unresponsive, the bystander shouts for help. "Arey, please, koi help ke liye aaiye bhaiya." And activating emergency response system by a mobile device and also asks the second bystander to get an AED and other emergency equipment. First bystander will now check for pulse and breathing simultaneously. Carotid pulse is being assessed by sliding 3 fingers down from trachea into the groove anterior to sternocleidomastoid and palpating. And the breathing is also assessed simultaneously by looking at the chest rise tangentially. It should be done for more than 5 seconds but less than 10 seconds. 1001, 1002, 1003, 1004, 1005, 1006. However, when no breathing and no pulse is present, we have to immediately start CPR at the ratio of 30:2. High quality CPR is to be given. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt chin lift maneuver is done to open the airway of the patient, and 2 rescue breaths are being delivered: 1001, 1002, 1003, 1004. As soon as the AED arrives, switch on the AED. Apply the pads on the anterolateral position, left side below the nipple area and right side in the infraclavicular space. Follow the AED commands.
Shock advised. Charging. Stay clear of the patient. Deliver shock now. Shock delivered. Start CPR.
The qualities of high quality CPR are 30:2 ratio as compression to ventilation ratio, depth of at least 5 centimeters, adequate recoil, minimizing interruptions to less than 10 seconds, rate at the rate of 100 to 120 per minute. Now, after 5 cycles of CPR are over, switch compressors. While switching, do not cross each other. This was the scenario when the patient had no pulse and no breathing. There can be other 2 scenarios. In one of the scenarios, if the patient pulse is felt and person is also breathing normally, we have to monitor the patient until emergency responders arrive. In another scenario, if the person is not breathing normally but the pulse is felt, rescue breaths are to be provided. 1 breath every 6 seconds, and each breath is to be given over a period of 1 second. 1001, and after 6 seconds again 1001. Pulse is to be checked every 2 minutes. If in between we are not able to feel the pulse, we have to start with the CPR immediately. Thank you.